Hello, everyone, and welcome to Module 1 Understanding Visual Impairment. Before we dive into details, let's go over our learning objectives for this discussion. By the end of this report, you will be able to define visual impairment and classify its different types, explain how visual impairment impacts learning, development, and daily life, identify appropriate teaching strategies and assistive technologies for individuals with visual impairments. Compare and contrast CVI with other types of visual impairments. Assess the effectiveness of legal definitions and support services for individuals with blindness, and design an inclusive learning for students with visual impairment. Now that we know what we aim to achieve, let's begin by exploring what visual impairment means. Visual impairment refers to a broad spectrum of conditions that affect a person's ability to see clearly, even with the use of corrective measures such as glasses or contact lenses. The World Health Organization classifies visual impairment based on severity. It can range from mild vision loss to total blindness. Here are some key points to remember. Visual impairment does not always mean total blindness. Some individuals may have residual vision that allows them to see shapes, colors, or movements. Vision problems can occur from birth, develop over time, or result from injuries or medical conditions. Assistive technologies such as magnifiers, braille, and screen readers help individuals with visual impairments live independently. For example, think about looking through a foggy window. Your ability to see objects, read text, or recognize people would be affected. This is similar to how some people with visual impairment experience their surroundings. According to the International Classification of Diseases by the World Health Organization, visual impairment is classified into 4 levels. The first level is mild visual impairment. A person with mild visual impairment may struggle with fine details but can still perform most tasks independently. They might need high contrast colors, larger fonts, or brighter lighting. For example, a student may need larger texts in books but can still read without assistive technology. The second level is moderate visual impairment. A person with moderate visual impairment has difficulty recognizing faces, reading books, or identifying objects at a distance, even with corrective lenses. They may require magnification devices or screen readers to help them access information. For example, a teacher may need to use bold, high contrast colors on the board for a student to see the lesson. The third level is severe visual impairment. These individuals experience significant difficulty performing everyday activities. These individuals might need orientation and mobility training, white canes, or guide dogs. For example, a person may need a white cane or screen readers to navigate their environment. Fourth level is blindness. This is the most severe form of visual impairment. So the person is unable to perceive light or has extremely limited vision. For example, a person with blindness may rely entirely on braille, auditory cues, or mobility aids to function in daily life. Key measures for classification are visual acuity and visual field. Visual acuity refers to the sharpness or clarity of vision. This is measured as a fraction, for example, 2020 or 2200. The first number represents the test distance, for example, 2020, so the first number is 20 feet, while the second number shows what a person with normal vision would see at that distance. Meanwhile, visual field refers to the total area a person can see without moving their eyes. It is the total area a person can see while focusing on a central point. A normal visual field is about 180 degrees horizontally. In many countries, Legal blindness is defined as visual acuity of 2200 or worse in the better eye, even with corrective lenses, visual field of 20 degrees or less, leading to severe peripheral vision loss, or also known as tunnel vision. For example, a person with legal blindness may still see large shapes and colors, but cannot read standard print or recognize faces from a distance. So, how does the legal definition of blindness help in determining who qualifies for disability benefits and supportive services? The legal definition of blindness helps determine who qualifies for disability benefits and supportive services by setting clear medical criteria. This ensures that individuals with severe vision loss can access financial aid, assistive devices, mobility training, and educational support to help them live independently. Now, for the types of visual impairment, they manifest in different ways, and main types include low vision, blindness, CVI, and color blindness. Individuals with low vision have significant vision loss but can still use their remaining sight for daily tasks. These individuals can still see but need adaptations. Common conditions are age related macular degeneration or AMD and diabetic retinopathy. They may require large print materials, magnifiers, or high contrast colors. For example, a student with low vision may use a magnifier to read their textbook. Next is blindness. These individuals have complete or near complete loss of vision. They rely on braille, tactile graphics, and auditory information. For example, a musician who is blind may read sheet music using braille notation. The next is cortical visual impairment, also known as CVI. So it's a brain condition affecting visual processing. The eyes may function properly, but the brain struggles to interpret what is seen. For example, a child with CVI may see an object but not recognize it until they touch it. So, what challenges do individuals with CVI face that differ from those with eye related vision loss? So, these individuals face challenges in processing and understanding what they see, even if their eyes are healthy. Unlike eye related vision loss, which affects clarity or field of vision, CVI affects how the brain interprets images. People with CVI may struggle to recognize faces, objects, or movement even when they technically see them. They often rely on touch, sound, and routines to understand their surroundings. Then the fourth type is color blindness. So they have difficulty distinguishing certain colors. The most common is red-green color blindness. So, for example, a person may struggle to differentiate between the red and green traffic lights. Visual impairments can result from congenital or acquired conditions. Under congenital conditions, we have retinopathy of prematurity, albinism, and optic nerve hypoplasia. ROP affects premature infants due to abnormal retinal blood vessel growth. So, child born prematurely may require eye surgery to prevent blindness. Next is albinism. It's a genetic condition affecting melanin production, leading to visual problems and light sensitivity. So, a student with albinism may have extreme light sensitivity and requires sunglasses indoors. Third is optic nerve hypoplasia. It's the underdevelopment of the optic nerve, often causing severe vision loss. A child with this condition may need braille instruction from an early age. Let's proceed to acquired conditions. First, we have cataracts. These are clouding of the eye's lens, common in aging. An elderly person with cataracts may find it difficult to recognize faces. Next, we have glaucoma, which is the damage to the optic nerve, often due to increased eye pressure. So, a patient with glaucoma may lose peripheral vision, making it hard for them to navigate around crowded areas. Third, we have diabetic retinopathy. So, vision loss is due to diabetes related blood vessel damage. A person with uncontrolled diabetes may experience blurred vision and blind spots. Lastly, we have age related macular degeneration. This is the loss of central vision while peripheral vision remains intact. So, a person with AMD may struggle to read but can still move around independently. Visual impairment affects multiple aspects of a person's development, including cognitive development, social and emotional development, motor and physical development, and academic development. For cognitive development, learning often relies on sight, making concept development slower. So, a child with visual impairment may need hands on experiences to understand concepts like big and small. Second, social and emotional development. These individuals have difficulty recognizing facial expressions and body language. They may also harbor feelings of frustration or isolation. For example, a child may struggle to make friends if they cannot see social cues. Third, motor and physical development. So, vision is really crucial for balance and coordination. So, a child with visual impairment may need extra support to learn how to climb stairs safely. Fourth, academic development. Traditional teaching methods may not be effective, so a teacher may provide audiobooks and braille materials for visually impaired students to help them learn more effectively. In conclusion, visual impairment is a diverse condition that affects individuals in different ways. By understanding its classifications, causes, and impact, we can create more inclusive environments for education, employment, and daily life. Thank you so much for listening. If you have any questions, feel free to review the material or reach out for further clarification.